welcome back again. So today we can discuss next genetic disorder, that is Patau syndrome. So we already discussed in the last class about the deletions and types of syndromes. Okay. Now we are going to discuss trisomy today. Okay. So first and very important trisomy, that is trisomy 13, also known as Patau syndrome. Okay. So this is happening every 1 in every 16,000 live birth. Okay. And 90% of the baby's birth will survive only 1 year. Okay. And the very important symptom is in the hand. You can see in the palm, the pattern of the palm, that is abnormal palm pattern is very important. Okay. And let us go to the history. So trisomy 13, the term itself indicates that it is happening in that extra addition is in the chromosome number 13. Okay. And this is first observed by Thomas Bartholin in 1657. Okay. And later you see in 1960 what happens is another important famous scientist, namely Klaus Patau, he described its genetic basis and everything. Okay. And later this is renamed as Patau syndrome. Okay. So Patau syndrome is a name mainly due to the from the scientist Klaus Patau. So Patau syndrome or trisomy 13. So it is happening somewhat frequency in both male and female somewhat equal. 47 chromosome will be there. If it is a male, it is 47XY, female 47XX. Okay. And the plus 13 is because addition is in that 1, 46 plus 46 XX is female. Okay. So 46 plus 1, where it is the one attached extra, that is the chromosome number 13. Okay. And its frequency increases with the increasing age of mother. So extra chromosome is generated due to random events, usually due to translocation and also during the time of conception. This is the conception time and also by translocation. And Patau syndrome, the main symptom is cleft palate and another symptom is the polydactyly, number of fingers. See, this is a cleft palate image, you can see cleft palate, and this is the polydactyly. Okay. And you can see the karyotype here. While looking into the reaching 1, 2, 3, 4 by count and reaching into the chromosome number 13, this is what is the chromosome number 13. So what happens in chromosome number 13 is, see, I will show you. Chromosome number 13, when you look it, when you look this chromosome number 13, you can see this is an extra chromosome in the chromosome number 13. Okay. And symptoms is usually somewhat same as that of other type of disorders. Usually mental retardation will be there, mental deficiency will be there, the low birth weight and affecting the neural or nervous systems, especially absence of corpus callosum, that a bundle of neuron fiber in the cortex in the brain that will be absent. Then hypoplasia of cerebellum, sloping of forehead, etc. I will show you the image. Then malformed ears will be also affected. Congenital heart diseases will be there. Then renal tract, kidney and other related organs. Then bilateral cleft palate, that's important, and polydactyly. Okay. Then mosaic Patau, another one. So mosaic trisomy 13, you can see uniformly distributed in all cells. That is a common condition, trisomy 30 or Patau syndrome. But when it is mosaic Patau, what happens is the copy, extra copy is not distributed uniformly in all cells. So randomly distributed extra copy. Okay. So that's a mixed nature. This condition is known as mosaic Patau. That's very rare condition. Okay. Then common problems, you can see the three important main identifying feature of Patau are: one is polydactyly, finger number extra. Okay. Then that pattern of palm pattern, abnormal palm pattern, simian line. Okay. Simian line. And another one is rocker bottom feet, heel and feet, that is prominent heel and deformed feet, that is rocker bottom feet. Three important points. Then cleft palate I already told you. Okay. So palm, fingers and foot are three typical symptoms. The treatment, actually there is no particular treatment for this disease, but surgery is usually fixed for people to fix defects. Okay. The patients to fix defects. Otherwise, no. Then special management and procedures are necessary for caring these patients. Okay. And the first few days it's very difficult to survive. These are the various images or Patau affected people. Infants, see, small head, absent of eyebrow absent, the see cleft palate, dysplastic or malformed ears, you can see these malformed ears here, then clenched hands, very important, means undescended or abnormal testes. See how this child will survive, it's very difficult. If we are, if the treatment is there also, still it is very difficult to go forward. Okay. Then that's all about Patau syndrome or trisomy 13. Now, let us discuss another important trisomy, that is trisomy 18 or Edward syndrome. What is trisomy 18? Somewhat same that of trisomy 13. Here extra chromosome, extra copy is in the trisomy, in the chromosome number 18. Okay. So, 47 plus XX extra in the 18, 47 plus XY extra in 18. Okay. Both male and female affected. And main symptoms include the mental deficiency as like all other disorders, loss at ears, malformed ears are there. Then another proper important point, renal abnormality that in that Patau syndrome it's also there. Then webbing of the neck, short sternum, etc. I will show you the image. See here, small mouth is small, small jaw, short neck, see short neck, no space between. Then chest shielded, sternum you can see that prominent sternum, wide set nipples, occiput, very important point. What is occiput? Back part of the skull is prominent. See, this is the skull, its back part is prominent. Then dysplastic, malformed ears, then clenched hands. Okay. Then flexed big toe, prominent heels. See, heels are prominent. Okay. You can see in backward it is prominent heels, and flexed big toe. That is another very important symptom. So, these are the symptoms by which you can identify an Edward syndrome with affected patient or infant. Okay. So, this is trisomy 18. As you can see in this picture, C chromosome number 18 is having that problem of copies. And there are different types of trisomy observed. So, it is a common syndrome, usually more common in girls. Okay. So, you can see three types. Full trisomy. What is full trisomy? All cells having an equal copy or extra copy in the chromosome number 13. Extra chromosome, every cell in baby's body. Every cell it is there. In that 18 there is an extra copy. Okay. And in the partial trisomy it is very rare. What happens is half of the extra copy is present. Half of the extra chromosome is present. So, it is caused by hereditary factor, but it is very rare. Half of the extra copy. So, 2.5, okay, instead of 3. And mosaic trisomy 18, another one. Mosaic Patau we discussed. Means every cell having not a uniform pattern of or uniform copy, or not that 18 having 3 copy in not every cell. So, each cell having different combinations. If some cells normal, some with 3 likewise. So, that is a random occurrence of this copy or chromosome. Okay, that is mosaic trisomy. This is happening due to the cell division, random occurrence occurring. Clear? So, that is also very rare, but most common type is all cell having equally that extra in the chromosome number 18. Okay. So, like a kid with Down syndrome, it was having different stages. Mild affected, severely affected likewise, but infants with this condition never survive. If it is happening in the teenage years, serious problems will be there, developmental problems will be there. Okay. What are the typical characters? Main characters or symptoms it is affecting is kidney, then esophagus, etc. And also hands, feet, ears, all problems, and head with the shape backward bend, that strawberry like shape, etc. will be there. Then umbilical and inguinal hernia, another type of protrusion of the organ. These are the common symptoms. So, you can see the two typical feature. One is clenched hand here, another one is loss at ear. See where the ear is placed, loss at ears. And so, we discussed two types of trisomy now. One is Patau trisomy 13 and one is Edward trisomy 18. And one more you already studied, that is trisomy 21. Down syndrome. Okay. So, in your syllabus you have studied 3 types of trisomy. Trisomy in humans. What are they? Patau syndrome, Edward syndrome and Down syndrome. You have to remember PED for trisomy. PED for trisomy, that is PED, P Patau, E Edward, D Down syndrome. PED for Patau, okay. PED for trisomy, clear? Then you have to study trisomy while asking question trisomy in humans. You can write all these three together, okay. Draw 13, 18 and 21. So that's all for today's class. Have a nice day.